Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Global Assessment of Functioning assesses an individual's overall psychological, social, and occupational functioning. It provides a single numeric scale ranging from 1 to 100 to rate the severity of mental illnesses such as schizophrenia, major depressive disorder, and bipolar disorder. The scale aids clinicians in determining the impact of psychiatric symptoms on daily life and social interactions. Its main purpose is to evaluate the level of functioning to guide treatment planning and monitor progress over time. The tool facilitates communication among healthcare providers by offering a standardized measure of patient status. The Global Assessment of Functioning is primarily indicated for patients with psychiatric disorders to evaluate overall psychological, social, and occupational functioning. It is most useful in clinical settings involving mental health assessments, including inpatient and outpatient psychiatric services. This tool assists clinicians in monitoring treatment outcomes and determining levels of disability or impairment. It is particularly valuable for populations with mood disorders, schizophrenia, anxiety disorders, and other severe mental illnesses. Its application spans diagnostic evaluations, treatment planning, and longitudinal tracking of patient progress. The Global Assessment of Functioning consists of a single numeric scale ranging from 0 to 100. The clinician evaluates psychological, social, and occupational functioning on this continuum. The process begins with a clinical interview and collateral information to assess overall functioning. The evaluator considers symptom severity and the ability to perform daily tasks. Scores are assigned in 10-point increments. Each range corresponds to descriptive anchors indicating levels of functioning, such as serious impairment, moderate difficulty, or superior functioning. For instance, scores between 1 and 10 denote persistent danger to self or others, while scores between 91 and 100 reflect superior functioning with no symptoms. The evaluator selects the score that best represents the lowest level of functioning observed within the evaluation period. Response format is numeric and ordinal, requiring clinical judgment rather than fixed items or direct questions. The result aids in treatment planning and monitoring progress by comparing baseline scores to subsequent assessments. Sensitivity refers to the ability of a tool to correctly identify individuals with a condition, while specificity refers to the ability to correctly identify those without the condition. Studies assessing the Global Assessment of Functioning have reported variable sensitivity and specificity depending on the clinical context and cutoff scores utilized. For example, when used to detect severe mental illness, the Global Assessment of Functioning demonstrated a sensitivity of approximately 0.75, indicating it correctly identified 75% of patients with severe impairment. Its specificity was reported around 0.65, meaning it accurately classified 65% of individuals without severe impairment. These values imply that while the Global Assessment of Functioning is moderately effective in identifying patients with significant functional deficits, it may yield false positives and negatives. Clinicians should interpret the scores in conjunction with comprehensive clinical evaluation to optimize diagnostic accuracy. The Global Assessment of Functioning test was developed as part of the 4th edition of the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association in 1994. It was designed to provide a single numeric scale ranging from 0 to 100 to assess an individual's overall level of psychological, social, and occupational functioning. Validation studies have demonstrated moderate to good inter-rater reliability, with intra-class correlation coefficients reported in the range of 0.65 to 0.85 across various clinical populations. Research conducted by Jones and colleagues in the late 1990s found significant correlations between global assessment of functioning scores and other established measures of psychopathology and social adjustment, supporting its convergent validity. Longitudinal studies have also indicated that changes in global assessment of functioning scores correspond with clinical outcomes and treatment response, suggesting predictive validity. However, some literature notes limitations related to variability in clinician training and subjective interpretation, which can affect reliability. Despite these challenges, the test remains widely used in both clinical and research settings due to its practicality and capacity to capture a broad view of patient functioning. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.